This is the first of a series of videos that my family and I have decided to make to show you the public what corporate medical companies are capable of. My name is Stuart. I'm 45 years old and my life and health have been damaged irreversibly by a hip implant that was manufactured, distributed and ultimately recalled by Johnson & Johnson and their subsidiary Synthes. These hip implants were a type of technology called metal on metal. They were promoted as the Rolls-Royce of hip implants. What the consumers weren't told was that these companies, as evidenced in court documents, were well aware that they were already having difficulties with the products, even up to the point of recall. I received my hip implant in 2007. The documents have demonstrated that the company was aware as early as 2004 that there were severe issues with these implants. One of the key issues with these implants is the shedding of metal ions of cobalt and chromium. This causes a condition called metallosis. Metallosis has the ability to cause immeasurable side effects that are still being discovered to this day in the many thousands of patients who receive them. The photographs that you are now looking at were taken by my surgeon mid-surgery after I had snapped an implant while standing from a chair. These are the one physical evidence that I can show people what metallosis looks like, as many thousands have asked me what it does look like. The areas that are circled are areas of necrosed tissue within the bone. Necrosis is a medical term for death. The arrows point to areas of necrosis within the thickness of the bone. This is irreversible. And the crosses show areas of metallosis within the multiple tissues of muscle, fat, and other tissues that surround the bone and joint itself. These do not show up on an X-ray, and they certainly do not show up in a circulating blood test, as this metal is sitting within these areas. So that evidence that is relied upon is not particularly reliable. On the table next to me, you'll see a large amount of medication, predominantly painkillers. This is what I have to take on a 28-day basis, purely to be able to try and walk and have some mobility, and certainly to try and gain sleep. Behind them are a pile of X-rays and bone scans. I've had to endure these for the past 5 years, ever since the product was recalled, and have provided evidence of the multiple surgeries that I've undergone. Beside these is a pile of emails. These emails were between my family and the company that is supposed to be caring for us, often begging and pleading for the support that they said that they would readily offer. You will notice a couple of business cards on top of this pile. My wife and I met with 2 executives from Johnson & Johnson. Their solution to our problem at that time was to give us a bed, which we had been asking for 8 months. I had spent 12 months prior to that sleeping in a chair, although they did manage to say sorry for what they had done. These X-rays are the only physical evidence that I can show you of what my hip looks like from the outside. Johnson & Johnson sent us to a doctor of their choosing. This doctor filed a report. He stated that my ASR had been implanted correctly according to company guidelines, that my wife would continue and will be my carer for the rest of my days, that I, as a 45-year-old, are classified as a geriatric, and that ultimately one of my very few options would be that my leg would be amputated. In summary, this technology was used by a great number of companies, and I certainly hope that they all have their day before the courts. This is a copy of the medical report, again independently done, which discharged me from the nursing and education career that I loved. It states again that my outcome is possible amputation. Please share this video with as many people as you can so that they can be aware of what these companies are capable of. Thousands of us around the world are going through the multiple side effects and issues that these hip implants have created. And I certainly do hope that these people will get their day in court. Thank you for watching this, and please be assured that there are more videos to come discussing this issue.